Hi, this is pharmacist Curtis Alexander. In this video, I'll be covering the medication Avonex. So Avonex is used to treat multiple sclerosis. So we'll just call it MS from here out, easier to say. So basically, we're looking at relapsing forms of MS. Now, one of the things to remember about Avonex, as far as the medications for MS, it's been around a long time. We have a lot of experience with its use. So that's one of the good things it has going for it. Interestingly enough, how does Avonex help MS? We don't really know. We have some theories, one of which is that it can enhance the immune cell activities in your body. But again, it always sounds weird to tell people that we don't actually know, but for the most part, we just, like I said, we have theories. One of the things to remember, so with Avonex, what's the dosage? Okay, so first of all, it's an IM injection. So IM is intramuscular, which means bigger, longer needle, more painful injection. Many people use it without any issues. It's just something to keep in mind out of the bat. So Avonex is the generic, it's an Interferon Beta 1A product. There is another Interferon Beta 1A by the brand name Rebif. I'll cover that in another video. It is a subcutaneous injection rather than IM, but there's some differences and some downsides to Rebif as well. But so it's an IM injection. You rotate it depending. It does come in a syringe form. It also comes in an auto injector pen, which those are nice. Auto injector pen has a downside. I'll get to that in a second. But if you're going to use a syringe, you can inject in the thigh or the upper arm. You do want to make sure that you're rotating in sites. It's a once a week injection, so week 1 you could do the right upper thigh, next week left upper thigh, then move down on those thighs and rotate that way. If it's the pen, you do have to stay in the thigh area. Now jumping back to the pen, it's really nice because it's an auto injector. But the downside of the pen is when you start Avonex, what a lot of providers will do, what your doctor may do, is start you at the 7.5 milligram and then move you up each week to a little higher dose. We call that a taper or a loading dose. And they may do that to try to minimize one of the side effects that we'll talk about in a second. The downside of the pen, it doesn't have the ability to do that tapering. You have to use the syringe and inject part of the syringe until you get up to the full dose, which is 30 milligrams once a week. Then you can use the pens. Okay, the pen actually is still an IM intramuscular injection, but it does come with a shorter needle compared to the syringe. Okay, and I don't want you to get worried about that. I know a lot of people who use the syringe, no issues, but if injecting is a concern for you, you may want to look at the pen. Okay. So we do have some warnings in one of those. These are rare. Okay, well, I'll get into the more common side effects in a sec, but when you consider using Avonex, we worry about autoimmune things, meaning if you have a disease state where your body is attacking itself in a way that's autoimmune, we get somewhat concerned about that because we can get autoimmune thrombocytopenia, which is low platelets. If you have something like Hashimoto's disease, which is an autoimmune low thyroid disorder, that would be concerning, something you want to keep in mind. We can see bone marrow suppression. Again, these are very rare, but it's important for you to know about them, okay? We do monitor 1, 3, and 6 months post-therapy. You can see liver problems, and you can see psychiatric disorders, okay? Again, very rare, just so you know about them. Now, the more common side effects, kind of touched on one, flu-like symptoms. This is really common, 14 to 25%. In real world, I think it's more towards the high end of that. I prefer to see people start out with that lower dose, work their way up, but you just don't feel good the day of injection. Flu-like symptoms, you don't have a lot of energy, body aches, those sorts of things. You can minimize that by taking Tylenol, ibuprofen, those sorts of things the day you do the injection, okay? But by far, this is the biggest complaint that we see from folks. You can see nausea, even though you're not taking it orally. You can see nausea, 23%. Generally speaking, I'll get to this in a sec, from an infection standpoint, it's usually well tolerated, but we can see an increase in urinary tract infections. 17% was the incidence. You can see injection site reaction, which means if you inject into the thigh, it can become red, a little bit of raised, swollen, just in that injection site area. Can happen, but this is all the injections that we have. This is a risk factor. So, and then weakness, which kind of relates back to the flu-like symptoms, but they called it out specifically and especially as 24%. So again, anything flu-like symptoms, somewhat common with Avonex, okay? So my overall thoughts on Avonex. The things I like about Avonex, despite just talking about these fairly common side effects and flu-like side effects, it's something that is actually, by and large, fairly well tolerated. So immune function is not terribly hit that hard. We did mention urinary tract infections. Outside of that, it does tend to still keep people's immune system, functioning well, and no significant increase in infections outside of this UTI concern. The downsides of Avonex, depending on who you talk to, there can be some tolerability concerns, and also, again, we're going back to that IM injection, right? So that can be kind of an issue for some people who don't want to do that. So that's Avonex in a nutshell. Let me know in the comments, have you taken it? If you know somebody else who's used it, what were their results? I love the feedback. The comments are helpful for me and other people as well. So like I said, let me know in the comments. Until the next video, I hope this was helpful. Thanks.